So, good afternoon, dear colleagues. Thank you very much for joining this meeting today. It's a great honor. I believe probably first time I'm in the room with so many experts, academics, educators at the same time, even though in a virtual room. My name is GChaltikyan, and I'd be honored to connect with all of you, if not yet. So you have my LinkedIn on the right side, right lower side, and there is also my LinkedIn in the chat, as well as the documents that we shared earlier, the concept paper, and the agenda of today's meeting, and the slides of this short presentation. I will start with a quick introduction on what we do. Based at Deggendorf Institute of Technology, a university in Bavaria, Germany. And we are recently designated, actually first in Germany, WHO Collaborating Center, specifically focusing on digital health education, research and development. We have operated a master program in digital health in the past 10 years. And interestingly, and I guess importantly for our subsequent conversation, this program was actually established as a Master of Medical Informatics 10 years ago. However, approximately 6 years ago, sometime in 2019, I started reforming the curriculum, and at the same time also renamed it or rebranded, some may say, into a Master of Digital Health. Furthermore, we are also hosting our DigiHealth Day, which is a global forum for education, research, innovation, and networking in digital health. This is how we call it, and it is essentially a platform for collaboration, communication, and knowledge exchange, and a series of events that culminate every year since 2020 in November with a few-day-long hybrid event, congress, which is hosted on our campus, European campus of the Deggendorf Institute of Technology. Later on, we will be speaking a bit more about the upcoming DigiHealth Days this November. We also delivered in the past 3 years. This is going to be the third year, the so-called blended intensive program, standalone certificate or micro-credential program on AI for health for ECTS. This is an EU-funded initiative or co-funded initiative. This is a special format that European Commission calls a blended intensive program, and we've enjoyed also collaboration with a few of our partner institutions on doing this program. It's a short, intense and training course, and this also takes place as a run-up to DigiHealth Days. Furthermore, we're a member of the Expanding Innovative Alliance project, EU co-funded project. We call it SHIA, in short, SHIA project. And this is a pan-European big consortium led by our colleagues at ISCTE in Lisbon and at developing and implementing micro-learnings, mostly dedicated to interoperability. We also do a couple of other projects, one of them notably on developing an extended reality app for tumor boards, or we're developing also an online course titled Global Digital Health. We have done a little bit of work on describing and presenting possible approaches to educating and training health workforce in digital health. We've developed several approaches. This was also published relatively recently in this book that you can see here, co-edited by our friends Armin Schroer and Jörg Studziński, where we published a chapter on education and capacity building. So a few words about the motivation behind this endeavor that our good friend Tino Marti suggested we preliminarily call an MDH alliance. Thank you for this suggestion. Tino, when we last met, I think it was in Paris at HIMSS Europe conference. So as we know, digital health education has been a bit fragmented. There are not always fully aligned and consistent competencies. There might not be always cross-border portability. There is no global accreditation for MDH. And we thought that there is a need for a recognized quality assured pathway. There is, we think, a need for shared assets, such as harmonized curricula, with possible regional specializations, such as joint modules, co-teaching. There's a need for a wider, perhaps, mobility and capacity building, especially across some underserved regions. As an example, we established the same program, MDH, also in my home country, in Armenia, and we operate it currently as a double degree. So this could be another possibility or another format that could be considered. And we think that there is a need to strengthen policy alignment and to establish credible graduate certification and career paths for graduates, and the certification, and to increase the credibility for employers. So these are all the motivations. I'm hoping that most of you probably have already had a look at this very simple concept paper that we circulated when we published this call. I have to say that since 2019, roughly 2018, 2019, I have been calling this degree already a Master of Digital Health, and we have been thinking quite a lot that why don't we try to achieve this global recognition and creation or development of an own degree designator, MDH. Of course, inspired by the story of MPH. So the key idea, of course, of this exercise, of this endeavor, of this project, whatever you'd like to call it, is to simulate the success of MPH as a globally accredited and well-known and acceptable master's program in public health, and to develop essentially MDH into MPH of digital health, so to say. And of course, we were also further inspired by the paper that our colleague, Professor Joseph Carr of King's, published relatively recently. I think it was in January this year in JAMA, along with the legendary Eric Topol. Fortunately, Professor Carr was not able to join us today, but I believe we have his colleague in this room, and that was another sort of source of inspiration, where we thought that probably we were going the right way. So it was just an additional sort of motivation for us. What could be possible goals or activities of this so-called alliance? And of course, let me reiterate again that nothing is finalized, nothing is written in stone, as they say so far. And our idea, our call, the goal of this and hopefully subsequent meetings is exactly that: to pick up your thinking as our dear respected colleagues and very experienced educators in this domain. So everything is basically should be considered as a draft or as ideas from our side that we would be absolutely happy to receive your feedback on. So the possible goals could be to develop a competency-based educational framework, to develop harmonized MDH curricula, perhaps a generic curriculum that could then be accepted or adapted or adopted or further expanded by individual institutions, perhaps to create an international MDH accreditation framework, similar to, again, what our public health colleagues did with MPH, to promote, of course, also institutional collaboration, to establish recognition, certification, quality assurance mechanisms, to strengthen overall the digital health workforce development. And of course, for all of that, ideally, we would secure some funding to sustain these activities. Now, what we'd like to achieve today, what we do today, we'd like to first of all hear each of you listen to you, dear ladies and gentlemen, to try to align on the vision and the value of such a globally recognized accredited MDH. We would like to hear, of course, from each of you regarding what you have been doing. Briefly, we might discuss and eventually agree on the very initial governance format or working groups. And of course, we'd like to plan a couple of next steps. And exactly based on that, we formulated today's agenda. After my opening remarks, I'm already a few minutes late, but I hope we will catch up later. We will invite each of you to provide 3-4 minutes, basically to give us some information, to introduce yourselves, assuming that probably not everyone in this room knows all others, which is also the case for me personally. So a brief introduction, what you do, possibly also a couple of words maybe of your motivation or your ideas or additional ideas. Absolutely, please feel free to structure your communication as you see fit, obviously. We would probably spend a little more than 1 hour. I'm assuming, considering that we are 32 people in the room now, some of them obviously from our team, but probably some more than 20, at least academics representing different institutions, not only, by the way, education institutions, education establishments. We also have some people from non-profits, think tanks, and so on. So we might then discuss a little bit this proposal and the working structure, and then complete with the next steps. On that, it is my pleasure to invite all of you to speak in a few words. You may do that absolutely with slides. If you'd like to, please feel free. This is an absolutely open format, so whatever works better for you, please go ahead. In order to avoid, to save time on mutual courtesy, if I may, I will be inviting you just according to the list of participants on my Zoom. If that's okay, then Tino, you are first on my list. Probably you would like